Hey everyone, it's noon. I'm glad you're joining us. I hope everyone is staying healthy and safe. My name is Kristina and I'm going to be your moderator today for the webinar we're putting on. It's being presented by NLGJA, the Association of LGBTQ Journalists, and it's being done through the association's partnership with and support of the CDC's Partnering and Communicating Together program to prevent HIV. So incredibly important partnership. It allows us to talk about events like the upcoming National Faith, HIV, and AIDS Awareness Day on August 30th, a day that's intended to engage faith communities to work together for HIV and AIDS education, prevention, treatment, care and support, and to reduce and eliminate stigma and discrimination. So thank you for letting me put that pitch in. I hope you all participate on August 30th. And as we kind of wait for a couple more folks to join in and join us today, I'm going to take care of a little bit of housekeeping. This session is expected to run about an hour. We'll have a formal discussion and then we'll also want to address some of your questions. So microphones will be muted except for those of us on this end, but please share questions in the Q&A tab. And we will do our best to address them as we go through this discussion. So as time permits, please send us the questions. We'll try and get them in. Also want to say this presentation is being recorded and we'll have it posted soon on nlgja.org/new ways. So when it's up, please do use it as a resource. So with that out of the way, I'm excited to turn to today's discussion. We're going to spotlight some of our work of the Excellence in Journalism Award winners. We've got two folks joining me today who are wonderful, and I know y'all are going to learn a ton from them. We have Excellence in HIV and AIDS coverage winner, Ben Ryan. And we also have our Journalist of the Year winner, Oscar Lopez. They're both going to be talking about their stories covering issues in funding HIV prevention, treatment, and care. And they both have some investigative skills. So we'll talk a little bit about the journalism, kind of the larger conversation about politics and public health, especially now as we're in this COVID-19 pandemic, and some a little bit about what motivates them and kind of helps them get their stories together. So as I mentioned earlier, my name is Kristina Torres. I am a board member, national board member of NLGJA, the Association of LGBTQ Journalists, and I was honored this year to serve as the committee chair of the 2020 Excellence in Journalism Awards. My pronouns are she, her, hers, and otherwise I will stop talking. I want to allow Ben and Oscar both a little time to introduce themselves, and then we can get into their stories. So Ben, if we could start with you, please introduce yourself.
Ben Ryan, I'm from Seattle. I live in Manhattan. I went to Columbia for English, and I've been doing HIV work in some capacity or never for about, it's been 25 years, I think, about this week. I got fired from a pizza job when I was a teenager. My mother said I should do volunteer work for the rest of the summer, so I went to volunteer with the local AIDS Foundation, and it turned into my career. So I've been covering the epidemic since I graduated in 2001. I was the editor-at-large at HIV Plus magazine from 2003 to 2010, and I've been an editor-at-large at Pause magazine from 2012 to the present. So I freelance a lot about science, been writing about climate for the Times National Edition lately, so writing for the Guardian, things like The Nation, Marshall Project, et cetera, et cetera. So I guess that's basically my bio.
All right, Oscar.
Hi. My name's Oscar Lopez. I'm actually from Mexico originally, and I live here again with my husband. But in between, there's been a lot of moving around. I actually lived in Australia where I finished high school. And then I lived in New York City for a while, where I kind of got into journalism. And after that, I've really been focusing on foreign reporting, international reporting, reporting in Europe, in Africa, the Middle East, and especially now Latin America. The focus of my work is really pretty consistently being human rights and especially LGBT issues. So I've reported on LGBT issues in West Africa, and now in Latin America. That's really the focus of my work. I'm sort of the LGBT correspondent for the Thomson Reuters Foundation, and I've been doing that for about a year and a half, almost 2 years. So that's pretty much where I am now.
Well, and you mentioned the Thomson Reuters Foundation, and the story we're highlighting today, it's one of those stories you did for them. And just really quickly, and always correct me if I'm wrong, it found sort of thousands of Mexicans who were living with HIV or at risk of infection were in danger of being left without life-saving services because the government had changed the way it was funding treatment and some other things. You tell us a little bit about the story itself.
Absolutely, yeah, that's pretty much at the heart of it. I mean, the new president who was elected in 2018 has been, Lopez Obrador has been sort of campaigned on the idea of ending corruption, which is a huge issue in Mexico, and it's partly why he won the election. And part of why this happened was that he's been trying to centralize purchases of medicine into the finance ministry to kind of cut out some of the middlemen and weed out corruption in that way, which is pretty noble as a cause and something that is definitely necessary because corruption is a huge, huge issue here. But unfortunately, it was just not done in the right way, and it was rushed through, and people and medications started falling through the gaps. And in this case, a lot of the people who are HIV positive and depend on the government for treatment were saying, you know, I'm going to the clinic, people are telling me that there's no medication, that I can't get my refill, that I have to wait. And it was happening all over the country. And so my reporting kind of focused on talking to those folks and trying to back up what they were saying to me with evidence. And so kind of trying to find sources within the medical community who could provide me with documents to show that indeed there were shortages occurring across the country. I don't think it ever got to the stage where people really, you know, were going weeks and weeks without medication, but definitely a lot of people were really concerned about not being able to get that treatment. And the issue with HIV, as Ben well knows, is that if you stay off treatment even for just, you know, a few weeks, your body can create resistance to the medication, and that can be incredibly damaging. And then you have to try and find other medication, and it just becomes a whole, you know, huge issue. So that's basically what the story focused on. There's been other shortages of other medication, cancer drugs, for example. But I think what my reporting is always focused on is on really, you know, the most marginalized people. And obviously people with HIV are often, you know, the least well served when it comes to public health, and people in the LGBT community, particularly trans women, are even less, you know, less well served. So that was kind of the focus of my reporting, and I was quite pleased that it actually did have something of an impact. For people outside of Mexico, the president actually holds press conferences every day, which journalists get a little bit tired of, but it does give you the opportunity.
Imagine that.
I know. They hold them at like 7 o'clock in the morning. So for the daily reporters, it's pretty exhausting to go and listen to the president every day. But it does give you the possibility to go and, you know, ask directly to the head of state what's going on. And so I managed to do that, and that kind of created headlines. And I think it really brought this issue to national focus that maybe it otherwise wouldn't have been. And eventually the government did do kind of like an emergency purchase of drugs. And even though the issue is still recurring in other government programs, it seemed like, at least in the Mexican Social Security Service, that shortage was resolved. So it was a really great experience for me, especially, I think, showing how important it is to kind of cultivate your sources. And I just have even just through friends and through social media, just have a lot of people that I can call on that can, you know, really tell me what's going on, because oftentimes as a reporter, you're not really sure what's going on. So that was really important to me, of relying on those networks.
Right. When you talked about cultivating of sources, and I promise you both we're going to get into detail on the HIV aspect, but I want to give Ben a chance because, you know, for Ben, I think it was really about kind of looking at records and data.
Yeah, a lot of that.
You
So,
know, and go ahead and explain what your story was. It was for The Guardian. I know, but go ahead and explain.
So similar to what Oscar said, mine really, the money that we're talking about in this article really has to do with serving disadvantaged communities, and especially LGBT people and Black and brown people in Florida, where the HIV epidemic is quite dire. You know, here we are in New York State, we spend a lot of money on it, there's a lot of cooperation between all the parties involved, and we're doing very well in the HIV epidemic. You hear often, like in national statistics, that HIV epidemic stagnant. But that masks ups and downs. It's going up in Florida while it's going down everywhere else, like in the Northeast and basically in blue states. So those things balance each other out. But so what I found out was that during Rick Scott's administration, which in Florida when he was governor, which ran from 2011 to the beginning of 2019, at which point he then became senator, in the middle of that, his administration essentially oversaw the effective blocking of $70 million in federal funds for HIV care, treatment, and prevention in Florida. And there were two parts to that. One is there were a couple of grants to the CDC that Miami and Broward County were applying for in 2015. And so they wrote all these grants. At the very last second, word comes down from on high, essentially from the governor's office on down the chain, that they can't apply for them. Now, the reason why, the excuse given essentially was in Florida, where they don't like spending outside money, if outside money comes in or might come in, this counts as a state budget increase, and all state budget increases have to be approved by the legislature. So essentially, this is a very convenient way, it would seem, that the government can lean on this administrative excuse so as not to have any new money come into the state from the federal government. And that's essentially what happened here. So you've got that excuse with those grants. And then what I found out was that between 2015 and 2017, there were $54 million in grants from HRSA that were rebates for the purchase of antiretrovirals for uninsured people in Florida. So the health department buys these drugs wholesale, and then it's called a 340B discount system, which means you get about a 27% discount on those drugs when you're buying them for underserved communities in certain contexts. So what happens is they'll say the drug's $1,000 a month, they buy it for $1,000, and then HRSA gives them back 27% of that. And after they're approved, as these drugs become more and more expensive, which they usually do, for however much more expensive it is beyond inflation, that amount is tacked onto the discount. So the discount can get bigger and bigger over time. And what happened was Florida stopped asking for unused money to be carried over from these rebates, and they stopped asking for approval from the legislature to spend them. And the money just started accumulating between this period of time in 2015, 2017, until it hit $54 million. Meanwhile, the epidemic is worsening in Florida after having gotten somewhat better over time.
Well, and the thing about it is, when I read your story, with several aspects, we have, you know, this interesting idea of, it was really, you know, there's almost obfuscation about kind of who was directing who to do what. Although, as you say in the story, you could tell the roads led to the governor's office. And this idea that you had the county officials, folks on the ground, this was a process that was almost regular for years. It, you know, even as complex as it is in detail. Then suddenly they've been writing these grants, and at the last minute they're told no.
Yeah. One of the there was an accounting part of the article, and that had to do with a lot of finding government documents through freedom of information requests, both on the federal and the state level, combing through them all. And then there were the personalities, and then there was the structure. So really, Florida, unlike in New York State, is very top down. It's governor's office, Surgeon General. He oversees the health departments, state, and then into the counties. So there's a huge amount of pressure, I was told. And one of the reasons why it took me so long to get all this information was because no one who works in this structure will talk. This huge pyramid is weighing down on them. So I had to wait until my main source had left. I first started reporting the story in early 2016, and I spent a month on it, but the key woman who knew what it was, and everybody was so mad at her, turns out it wasn't her fault at all, and she was upset right along with him that this money couldn't come out. She wouldn't talk until she left, and that's when I started getting the information 3 years later.
And she was a named source in your story.
Yeah, so her name is Marlene Lalota. She was great. It was because I had thought she was the villain, you know, when I first started reporting. It turns out not at all, and she was really aggrieved that she had to be subject to so much criticism when she couldn't explain why she was on everyone else's side, essentially. But really, what happened was it's at one key point in the middle of all of this blocking of funding, the governor's office took this woman named Michelle Talent. And she was, you know, an insider in their world, and they placed her overseeing budgets in the health department. And essentially, the buck would stop with her, and she was the only one with the authority to request the legislature approve more money. So, you know, I was being told by sources that she was doing this. It was unable. I never, of course, talked to her because she wouldn't talk. I do know she was put on leave last August. I never knew why, but. It was clear that that's essentially what the problem was. That I couldn't necessarily prove it exactly, but you could see in sequence and just provide that for the reader and have to make their own conclusion. So I was very proud that, you know, although the Senator Scott's office denied everything, the next day after my story came out, someone interviewed him in the Capitol, asked him about the story, and he did not deny any of it. He just spun off into some other topic. So I was just
Right, and in fact, if the story, they claim to have been, or Scott claims to have invested record funding in HIV and AIDS prevention.
Oh yeah, well, in 2015 he bragged they were spending record funding. It was $35 million, and it was all CDC grants. And the reason why he had bragged that this money had increased, well, the reason it had increased was because diagnoses had increased, which qualified them for more money from the federal government.
Yeah.
Plus, key point, he the healthcare company he founded was busted for fraud. And it was the largest fraud settlement ever in like 2002, and he left just about then and then pleaded the fifth like 75 times in this inquest. So he has a long history of considering government funded healthcare as a source of profit and not working for the people.
Right.
Consistent ideologically. So.
But you're dealing with this kind of government angle, and Oscar, you really did too, because, you know, for Oscar, the story you're talking about, I was struck. Actually, you know, you talked about source building, you know, and sort of being with the ear towards the ground, but then also dealing with this bureaucracy, a structure, you know, in this case, the federal government. You had a person in your story, Jorge Diaz, I believe an HIV positive man who had this routine down. He had to arrive before dawn at one of only a handful of public health clinics in Mexico City that catered specifically to people living with HIV. And it was almost, you know, he had this whole thing down. He had to do that. And then suddenly there was this issue of whether he can even get the treatment he needs.
Mm. Yeah, I think for a lot of people around the world, they really depend on the government for treatment because HIV medication continues to be like crazy expensive. And that's a whole other issue with giant pharmaceutical companies. And so they depend on government to subsidize and provide these kinds of services that most people just can't afford or have access to. And so when the government bureaucracy, as in Florida in Ben's story, or just the national bureaucracy in my case, starts breaking down, then these people who really depend on this treatment, you know, for their everyday lives, they start to lose out on this access. And that's considering, you know, they already have to jump through so many hoops. And as you mentioned, this guy who was one of the first sources in this story, because I saw him kind of complaining on Twitter, and I was like, what's going on? You know, a lot of people who deal with government bureaucracy in order to get this treatment already have to jump through so many hoops, getting to the right clinic at the right time. You know, this guy had to line up for hours, get there at 6 o'clock in the morning, and then they're told that no, you can't get your treatment today. You're, you know, in some cases it was your medication isn't available. In this particular case, it was like a labor dispute. There was like a strike at the clinic, and so that just like piled on to everything else that was going on. So at the same time that you had this like nationwide drug shortages, then there was this labor dispute at there's only 2 clinics in all of Mexico City that are specifically serving the HIV and LGBT community, which in a city of 20 million people is just really nothing. So you can understand how frustrating it can be to be, you know, coming to get this treatment that you really need, and then to have all these obstacles placed in your way. And I think that was just a good place to start, because oftentimes when you're dealing with a story that is very bogged down in bureaucracy and numbers, it's difficult to really tell the story unless you can follow, you know, a human voice that's been impacted by this. And I think that was really important. And I just, you know, like with any story, there's some luck involved in the fact that this guy that I was speaking to was not only HIV positive and, you know, having trouble getting his medication, but he also worked in the government. So he kind of like had a really interesting perspective on the whole situation.
Well, I was struck by your story. You're talking about, you know, this is how the government handles drug supplies. It's an issue of funding for these groups, you know, in terms of how they can coordinate and help treat and get treatment to, and other things, you know, the drugs to, you know, the patients they have. You know, and this now is happening just to kind of move it further in the pandemic. Have you noticed with your sources kind of how they're being affected through this?
Yeah, absolutely. I actually did a sort of follow-up piece recently about how people living with HIV were being affected by the pandemic in terms of accessing treatment, and specifically focusing on LGBT folks. And it was great to work with a colleague of mine in Kenya, and she was reporting on the situation in Egypt and in Uganda, where people were having trouble accessing medication. And I contributed from Mexico and looking at a different government program than the one I looked at in that original story. And this was one for government employees. Mm-hmm. And spoke to one source who, you know, went to the government and said, hey, there's a pandemic, I'm HIV positive, I don't want to be like going to hospitals or going to clinics to get my medication all the time. Can I get like 3 months in advance so that I don't have to, you know, come back for the next thing? And they said, oh no, sorry, your medication isn't available, which is obviously a huge red flag. And then he basically was left for over a week without any medication and had to go to a local NGO that could supply him with enough of the drug that he needed for that week, that he was just left with nothing. And then when he finally did get his medication, he had to go to a hospital that was determined that was kind of transformed into a COVID hospital. So you're putting someone at incredible risk to go and get their medication, which they, you know, really can't live without. And so then he was forced to go to this clinic, and this COVID clinic, and obviously he didn't want to go in, and so he sent his mom to go get his pills, and his mom has diabetes, so she's obviously immunocompromised as well. And so I think, once again, it's this issue that when the bureaucracy starts breaking down, the people that are affected, when these crises start to happen and everything starts to pile on, so now you have not just a medicine shortage, but now you have a pandemic, everything just becomes much more complicated, and for a lot of people, it really puts their lives in danger.
Yeah, well, you mentioned Uganda. I think United Nations AIDS was talking about recently. They've noticed fewer women coming into clinics for HIV to be diagnosed with HIV, and the number that came out with is that a 6-month disruption, and y'all forgive me, I have my glasses on, I'm reading, a 6-month disruption in access to drugs that prevent HIV positive pregnant women from passing the infection to their babies in utero could increase HIV infections in children by as much as 139% in Uganda. This isn't small potatoes, in other words.
Yeah, that
deal.
Similarly, UNAIDS, they made a projection recently. In sub-Saharan Africa, where the bulk of the pandemic, the HIV pandemic is, if there were a 6-month interruption in treatment for, I think, like 30% of people living with HIV there who are on treatment, it would lead to an extra 500,000 deaths by the end of next year, which would be a doubling of the current death rate from HIV-related illness. So essentially, it's a supply chain problem at its base, and a lot of these drugs, they're generic, they come from India, so those supply chains break down. It's a serious problem.
Right, and I think there's also concern that it's a very small, it's like what, 7 or 8 companies in India who do make them, and there are a number of things that can happen. They may have workforce issues. They could decide to start making a different drug because it's more profitable, especially in a pandemic.
Right.
Let's flip this a little bit. For both of you, just as reporters, as journalists, you know, with the backgrounds and experience you have, what do you think is the best way to kind of focus in on that kind of reporting?
In what sense? What kind of reporting you mean?
Well, if we're looking at, you know, especially HIV issues and prevention and sort of this disruption and treatment, how do you, just following the data and following source building as Oscar has done, how do you think it's maybe best to kind of pursue that kind of reporting?
I guess for me, whatever it is I'm writing about, who are the experts? Who, you know, I very much favor people in academia, and then you just keep asking who else should I talk to, and eventually you figure out who the people are in the know. One of the problems we're going to be seeing for the next couple of years is that HIV surveillance is going to be a lot patchier. So many fewer people are getting tested. So the kind of data that the CDC relies upon to give you a good sense of what's going on in the US epidemic is going to be a lot more sparse for the time being.
I got it. Oscar, what do you think?
Yeah, I totally agree with Ben that having those people know I'm not a scientist. I don't understand the ins and outs, medically speaking, but I think it's so important to have those academic sources, and then also having, you know, your ear to the ground, like you mentioned, Kristina. It's kind of frustrating that, like, we're encouraged to use social media, and I think nowadays social media is so divisive, and oftentimes I wish I didn't have to be on there because it's just such a crazy world. But I still find so many of my sources through social media, and so not only did I find sort of this guy that was having issues getting medication, but also one of the doctor that actually provided me with the documentation showing that the government was telling these government clinics, no, we don't have enough medication. Can you tell your patients to wait a little bit, or like give them just a week or 2 weeks or months of medication instead of 3 months while we like get this shortage sorted? That was a doctor that I found on Twitter and was communicating with her through Twitter. So I think trying to find both those levels is really the key. The kind of like high end, you know, academic scientists that can really give you the ins and outs of what's going on and why it's a problem, and then trying to find those kind of more underground, maybe a little bit more difficult to find sources that kind of give you either key documents or the kind of human angle.
Right. Well, the interesting thing, part of this, at least to me, you know, we've talked about this a little bit. It's, Oscar, I know you do a lot of work with the Thomson Reuters Foundation, but you do freelance, and Ben, you do also freelance, and in finding the support to kind of have time to do the reporting, resources you may need, which could also be financial. I mean, how do you all balance that? Oscar, why don't you go first? Just how do you do it?
Well, it's really tough, and I have to say I've been really lucky in that I've been pretty much working full time for the foundation, even though I'm still a freelancer, for about 1.5 years now. No, sorry, like 9 months. Although now because of the pandemic,
It feels like
well, my hours have been cut because budget cuts, etc. So, and I think that's, you know, because I'm a freelancer, I really have no kind of work protection or unemployment or health care or any of those things. So, I mean, I do feel lucky in the sense that I was able to have that financial stability when I was reporting on this story. And, you know, there were days when maybe I wasn't producing an article, but I was still getting paid because I was spending the time cultivating sources and talking to people and spending time on Twitter and all these things that you have to do that maybe don't produce immediate results, because it's still like the key part of your job. And so I think that's really tough and I freelanced completely for years, and it's really hard. And I think actually last year I also won an NLGJA award for international reporting. And it was for an article that I did in Senegal that I spent, you know, probably 2 or 3 weeks on, and got paid like $250 for the story. And it's an award-winning piece, you know. And I think that's and the only reason I was able to do it was because I had the support of a foundation that gave me a grant to go and do this reporting. And I think that back to your earlier question is like, how do we make sure that these stories keep being told? And I think it really does come down to resources in a big way, because if we don't have the resources to commit time to cultivating sources and digging into these stories, these major public health stories, then they're not going to get told. And so right now, I think it's really tough when budgets are being restricted and people are getting fired at major media organizations all over the world. I think the question facing us is like, how do we still keep telling these stories if there's not the resources that we need? And I don't have the answer to that. And I've always, I've struggled financially for years. And a lot of it has been through foundations and grants and prize money and things like that. But it's definitely not easy. And I think that it's a big question hanging over the industry that still needs to be resolved.
Right. Well, and Ben, and I want to come back to that, but Ben, you talked in part about the sort of the same struggles of this idea of balancing that with this idea of it's speaking truth to power.
Yeah.
Trying to either right or wrong or just expose a fact that's not out there.
I mean, I remember being in college when I decided to be a writer, that one of the primary emotional motivations that I was conscious of was speaking truth to power and being able to expose wrongs. And seeing All the President's Men as a kid, that's just the apex of it. People are digging it. It sounded so exciting. And this was very gratifying for me. I had done the piece for The Guardian on Rick Scott's administration. The previous year I'd spent, oh God, it was something like 7 weeks straight investigating Harvey Weinstein's financial machinations. He was essentially money laundering with AMFAR, this HIV charity. And Kenneth Cole was at the board, and he was maybe looking the other way while this is going on, and so on. There's a huge conflict in the board. And so working that was very exciting, but it didn't reach a lot of people in the end. So I decided that with this, I published it with Pause Magazine, which I write for on staff. So I decided to go to The Guardian with this one and hope so it would reach more people. But yeah, I mean, as you were saying, like, I have to have sort of the stable job and the money job. I was a cater waiter for 15 years, trying to make ends meet, that sort of thing, to finally get to a point in my life where I can square away time, where I'd spent like 100 hours on this investigation for The Guardian, and the money wasn't money was not important. Essentially, it was just the opportunity to get to do what I kind of always dreamed of.
Right.
So very rewarding in that sense, and to really make a mark, and to have government officials being asked questions about this in press conferences, and essentially being told that you are being watched, that there are people out there, just me in my little bedroom somewhere, taking a little shot at these powerful people. So that was very exciting.
Right. And Oscar,
I think,
I was going to say, you said you never imagined when you were younger you'd be able to sit there and look at the president and ask a question about your investigation.
Yeah, and it was definitely just a remarkable moment to literally like bring this up to the president. And I think, if the president is going to leave himself open to having press conferences every day, then, journalists should hold him to account. And I think, unfortunately, in Mexico, that doesn't happen as often. I'm always really impressed with U.S. reporters that, no matter who they're interviewing, they really just nail those questions and kind of try to get at the bottom of things. And here, the media landscape, oftentimes, often newspapers and magazines depend on government funding through advertising. And so there's kind of a bit of a resistance to really cause any kind of controversy, which is really detrimental to the kind of stories that people can tell. And I've heard of stories of stories getting killed at newspapers by government officials, basically, which is, the worst kind of censorship. And I think that's something that I'm very conscious of as a foreign journalist, that I have a lot more freedom here. I have a lot more protection. Mexico is one of the most dangerous countries in the world for journalists. And as a foreign journalist, you're kind of a little bit more protected because I'm writing in English, and the kind of people that might get angry enough to want to cause harm probably, aren't reading the kinds of stories that I'm writing. So that's something I'm always conscious of, because I do have an incredible amount of privilege here. And so if I can use that to, you know, expose some kind of wrongdoing or help people who maybe are suffering, then that's always sort of been the focus of my work. And yeah, that's why this story was so gratifying to be able to you know, bring this issue to national attention by taking it to the man himself.
Right, and not only that, but getting an answer, because I mean,
Right. And what was good was not just because, you know, when I asked him a question in a press conference, as politicians do, they tend to just kind of ramble and do their thing. But getting an answer from the government in terms of them actually doing this purchase of drugs that were badly needed, this emergency treatment, just showed me that, you know, actually when, and not just, you know, I can't just take credit for it myself, it was my reporting on top of all the local journalists that were covering it as well, that really added on that pressure that made the government actually take action and respond to this outcry and ensure that people who needed their treatment were getting it.
Thinking about that, especially now, you know, we talked about we're in a pandemic. It's an extraordinary situation, incredibly challenging. Where do you see kind of with the HIV reporting especially, because that's, you know, with our focus on that today, what do you think is kind of the next big story? Where do you think people should be looking?
Well, it's good, as we were saying, disruptions to care, treatment, prevention. So, I mean, so much work has been done to roll out PrEP here and around the world. That's going to be seriously interrupted. A lot of people are going off PrEP. Does that mean, sure, they're not having sex, but then all of a sudden they do, and they didn't have the 7-day lead-in taking Truvada or Descovy to cover themselves? So, I mean, every story about every topic right now is how is this industry or situation disrupted? And of course, then there are all the parallels. You know, for my story, you know, it's about Republicans' attitude towards spending money on the public, and that's exactly what we're seeing with COVID. Not just spending money, but also just trusting experts to know what they're doing. These people in the health department were being so micromanaged; they just couldn't do their job. Whereas during the Jeb Bush administration and in the 2000s, they were given a lot more freedom and leeway. That's something that Jeb Bush and George W. Bush don't get enough credit for, is the HIV work that they did do. It was George W. Bush who founded PEPFAR, which is why we've been seeing such incredible success in sub-Saharan Africa in particular in rolling out treatment there. And Debbie Birx, in fact, for all the criticism she's gotten lately, has led that charge quite expertly. So she certainly deserves a lot of credit there. So it's essentially, you know, how is COVID disrupting what, you know, in some places is a well-oiled machine, in other places is already catastrophic.
Right.
And I think that's,
go ahead, Oscar.
That's definitely, sorry, yeah, that's definitely the story at the international level as well. I mean, you mentioned already the way the UN is projecting how this will affect countries in sub-Saharan Africa. And I think that because a lot of developing countries depend on international aid in order to confront the HIV epidemic, now that, you know, budgets are tightening, that maybe there's not as many resources as there were before, definitely seems like PrEPFAR is not as much of a focus as it was before, as Ben mentioned. We're definitely going to see a lot of the strides that have been made in these developing countries towards, you know, confronting this epidemic kind of take steps backwards, and we've already seen data coming out to support that. And it's just kind of heartbreaking because a lot of countries had made huge improvements in terms of testing and treatment, and now as we see, you know, this kind of taking steps back, what's going to happen, and it's always a domino effect, you know, like what is COVID going to do to HIV treatment and prevention, and then what is the lack of HIV treatment and prevention? How is that going to affect other health parameters and
the economy, certainly.
And the economy, exactly. So I think it's definitely looking at the disruption, and then also like what's next, what's the follow on, what's the ripple effect from these disruptions and this lack of access to public health in countries, you know, that really don't have the health infrastructure that's needed. And also, you know, frankly, in the US as well, which, you know, really the HIV rates are pretty staggering for a country that has so much money. And Ben knows a lot more about this than I do.
there are countries in sub-Saharan Africa that are doing so much better than we are. And the funny thing is, it's the United States that it can take the credit for that, because we're spending the money there and designing the programs, but we can't, with our fractured healthcare system here, do that as effectively.
Right. But the question, or at least one of the questions I've heard, and this is interesting from a national perspective and Oscar, an international perspective, of how long-term is this, right? There's the clear disruption. We're looking at supply chains and that type of thing, the economic effects. You know, is this a turning point for the worse, and will it have a long-term effect?
Well, I think one question to ask is, will this cause state, local, and federal government to realize that you really do need to spend money in public health for the long-term benefit? And as we keep hearing, you know, public health does it best when people think you overreacted. So what happens is public health is going fine, we need to cut our budgets. Oh, we don't need that because there's no problem, and then the problem arises again. So that's a big question for me, but with less money, I'm not very optimistic. One other thing I wanted to mention, you know, the idea of being off HIV medications for even a few weeks, not only can that give rise to drug resistance, but also when the virus is unsuppressed, it increases the chronic inflammatory state in the body that's already there even when it is suppressed. And that is associated with so many other problems like diabetes, cognitive decline, bone decline. This isn't necessarily all that well understood, but people know that it is of the utmost importance to have you spend as much time as possible with viral suppressed for the entirety of having HIV. You know, ideally you would be treated the same day you got it, and there's so many benefits for the long term that could be seen decades down the road, just from reducing the amount of time that you spend with a detectable viral load from, say, a year to 3 months after you were diagnosed.
Oscar?
Yeah, I think that this is definitely like a completely world-changing moment we're living in right now, and I don't think we're going to know what the real repercussions are until years from now. Yeah. I think all of us kind of hope that it would, you know, kind of be something we dealt with for a couple months, and then, you know, life would go back to normal, and that's just not the case. And every day we're seeing, you know, the U.S. is just crazy what's going on right there right now. Mexico as well. You know, we have the third highest number of deaths in the world here in Mexico now. And so I think there's a lot of obviously negative impacts. You know, people are dying, and that's a really tragic thing to witness. But I hope that there's also, like Ben mentioned, kind of a conversation that's ignited about the importance of having public health. And I think in the U.S., I kind of am a bit of a U.S. politics junkie, and just watching the primaries play out and how this idea of having public health care for everyone was so controversial and so, oh my God, that's just crazy and sounds like communism. And then you see the impacts of not having a robust public health system where, you know, people are being charged crazy amounts just to get a test and getting billed for being in hospital and all these things. And I think that it is starting to provoke those kinds of really serious questions that people haven't been willing to ask. And I think the same is true in Mexico, where we're seeing, you know, that there's not enough equipment, and that the public health spending in Mexico is one of the lowest in, like, as a percentage of GDP out of all the OECD countries. And what you get is a country that can't confront a pandemic like this. And so everything seems to be going along, you know, sort of okay in either countries until something like this hits, and then people and systems aren't prepared to deal with the crisis. And so I hope that out of all of this, that something that emerges is the importance of having a more robust public health system, whether it's confronting a long-lasting epidemic like HIV or something more of a crisis like COVID-19.
Well, and as we kind of watch that and kind of going back to the journalism side of this discussion, and I'm inspired by a posting in our chat. It's not quite a question, but I think there's a point of saying, you know, reporting still needs to happen. We talked about that journalists are needed to kind of ferret out the facts and talk about the truth. You know, how do y'all approach kind of, you know, Oscar, you mentioned, you know, using social media to find a doctor or just going and finding someone at a clinic. getting folks to talk who want to say something, but either don't think they're going to be taken seriously or fear retaliation, such as a doctor maybe working in the government clinic. How do y'all approach that? How do you encourage people just to kind of take that leap and trust you as a professional?
For me, it starts out with your entire career. Are you an assiduous journalist? I am so obsessed with fact checking, so that when I know that article is right when it comes out, because I have been slaving over it. And I have a system where when I start my fact check, I take the Word document of the article, I turn all the letters red. And then as I go through, if I've sent an email to somebody saying, checking this fact, I'll turn that blue knowing it's pending. And then when I find something is right, I'll turn it black. And in this article, I added purple, which was meant, I checked it some, but I wanted more redundancy. So just having that in your history and having people been satisfied with the work that you've done with them, you quoted them correctly, the article was right, the article was fair, it was truthful at its core. That means that when they say, who is this guy, to somebody else, they'll be like, oh, he's really trustworthy, he's been doing this forever. So having that as a baseline is so important. And I really did have to build up trust with people and just keep telling them, you can trust me, I want to get this right. And I talked to my main sources. There were 4 people who worked in the health department who talked to me at length. And I talked to them repeatedly. And I find that when you're doing investigations, if you talk to people more and more, they'll just keep running their mouth off. And pretty soon they'll give you even better quotes because they'll just feel more free to be critical or whatever the topic is. And then the rest of the article was just looking at documents. And I have 30 pages of single-spaced handwritten notes on all these budget documents, trying to make sense of them and making charts and marking charts of what the HIV rates were in all the different states. And I've always loved charts. So I'm back in the 6th grade, like charting the weather, the temperature per day, and this, for school. And so I got a kick out of that.
I got it. Oscar, how do you do it?
I think, like Ben says, it's really important to have your background, solid, not just in terms of having great work out there, which is obviously key, but also kind of letting, particularly when you're dealing with sensitive topics, to let people know that this isn't your first rodeo. And I think with Ben's, long history working on HIV, that obviously gives him huge credibility. And I think for me, the fact that I've been working on LGBT issues for years, and I have so much evidence that I can show people, yes, I've reported on, trans rights in Senegal and stuff like that. And I've spoken to people in really difficult circumstances, that they can see my work and be like, okay, this guy knows what he's talking about, and he's not going to misgender me or what, whatever some of the risks can be. And then I think the other point, because a lot of the issues that we're dealing with are so sensitive, whether it's HIV status or sexual orientation, gender identity, is to be able to afford people anonymity when they ask for it, and to really keep that sacrosanct. I think it's so important. And I think it's really difficult nowadays because there's so much distrust of the media and who are these anonymous sources? But if you're someone living with HIV and revealing your status could get you fired, of course you're not going to want to talk to a journalist who's going to put your name all over the place. So you just have to be so careful to reassure people that if you don't want your name to be published, I will not publish your name. I'm not going to talk about you on social media. And really respect that. And if people can see that you've done that in the past, you can give them that reassurance that you're going to do it again. And also, if people just don't want you to talk about them at all, then you don't use them as a source. And that's, they might be a great source, but you need to respect that boundary. And I think that's really important for gaining someone's trust. I
got it. This is going to sound weird, but go with me on it. It's as you're kind of developing those sources, and Oscar, I know from your award-winning package that you submitted to NLGJA for our Excellence in Journalism Awards, you kind of have a knack for kind of going in and just talking to people, or at least it comes across that way, that you can go to everyday situations, the party in a warehouse, and just go in and have a connection. And that to me seems to be critical, in the reporting I've done, where you have data, you have the reporting, the FOIAs and the open records requests, but you also need to be able to make a connection. I think you both do that very well. And that's why I'm bringing it up. It's the importance of the human touch.
Most of what I do is talking to academics, actually. So as I write about science, so because I'm always hearing the recordings of my voice when I'm transcribing, and I'm just like, oh, I sound awful. For so many years, I sounded asleep, and I realized when I really started interviewing a lot of academics or medical doctors, I would stammer a lot when I was asking the question, and I realized that was me trying to apologize that I didn't know enough. And as I both grew to the point where I did know more, my confidence got better. I realized, like, one of the ways of getting to trust you is sounding like you're not afraid of them. My father's a doctor, so, you know, sometimes even when they'll like act out, you know, and they'll get mad for some reason, I'll have to like give them a talking to or something, but that's very rare. But it's essentially sort of over the phone sounding like you're sort of having a friendly conversation with them. I often will make jokes, make personal reference, and just try to get them at ease so they feel like they're talking to a friend over lunch and not just being quizzed. And that tends to make their quotes lighten up a lot, and they'll sort of be more free with you. Not like it's not even a matter of like, are they withholding information, but just like, how fluidly do they talk with you?
Right. And Oscar, you have a knack for it, so.
Well, I don't know if I have a knack for it or something that I just had to develop, because when I sort of started my freelance career in 2015 and went freelance, and it was kind of at the height of the refugee crisis in Europe, with, you know, millions of people coming from Syria into Europe, and I just found it a really fascinating story, and I just decided, like, this is what I want to report on. And so I just like had my backpack, and I was just kind of traveling to these refugee camps in Europe where most of the time I didn't speak their language, you know, Arabic or Pashto if it was, you know, people from Afghanistan, or, you know, other languages. And so we kind of had to communicate in sort of broken English on their part, and me trying to explain, you know, my questions as well as I could. And I just kind of had to do it. And so it was really scary at first to just like be in a refugee camp in the middle of nowhere. You don't know anyone, you don't really speak the language, and you just have to go up to total strangers and be like, hi, I'm this white guy, can I ask you some questions? And every time it was really, really hard, and I would just feel so like embarrassed and like, what am I doing here? And then I don't know why, I just always just pushed myself to be like, just go up to someone and just ask them a question. And, you know, I did that for months, and I covered this story, you know, all across Europe and the Middle East, in Greece, in Jordan. And eventually I just kind of was just started doing it. And I still get nervous now when I'm like kind of going up to someone in the middle of a protest or something like that. But I just kind of have learned to just sort of silence that voice of doubt and just be like, you've been doing this for years, and like very rarely does anyone not want to talk to you.
Yeah.
So just do it. And I think that was kind of my steep learning curve.
Okay, it's almost like a lot of us, and I'll raise my hand. It's you almost have a natural tendency to be an introvert, but journalism.
Yeah, I was just about to say that. I was just about to say that. They're like, I still get nervous just calling someone on the phone.
Me too.
To talk myself up.
I hate it.
You've literally interviewed thousands of people. What could go wrong? You know.
So what's next for you guys? It's Oscar. I'll start with you. It's what do you have on the horizon, and what do you want to do?
Well, I am still working for Thomson Reuters, which for the foreseeable future is a great place for me. I've always wanted to report on LGBT rights, and that's pretty much what I do. I kind of feel like I've kind of reached a really great spot. I kind of want to go a little bit more into, you know, it's kind of funny because when you're freelancing completely and you get to do all these like great long reported stories that you can spend weeks on, and you kind of you can write like a 3,000 word story, you kind of wished, oh, I wish I just had a regular job. And then when you have a regular job, you're like, oh, I miss those really like, you know, long reported pieces. So I think now I have a little flexibility. I'd like to focus on some more long-term reporting, and I would really love to kind of go more into book writing potentially, and I'm kind of developing a couple of projects. So I think that's where I'm headed, is kind of going into some more in-depth work, because I feel like I've been doing this sort of a lot of news for a while, and I'd like to get back into the kind of more narrative journalism that kind of was where I started out.
I got you. And just real quickly, you mentioned, I know you've moved around a lot and had such a great experience in terms of where you live. Are you going to stay in Mexico City?
I think we're going to be here for a while. I think it was a really interesting process of coming back here. I kind of resisted coming back to Mexico because it felt like kind of going backwards in a way, like taking a step back. But actually, it's afforded me so many opportunities, and it's just really, for all its issues, it's definitely got a lot of problems, but it's just a really wonderful place to live. And I think part of the reason that I was resistant to coming back here was kind of feeling like it was, not being able to find a kind of queer community here in a country that is very macho in a lot of ways and seems like a very conservative society, but then realizing that actually, and that was one of the things that I loved in that story that I submitted about the nightlife scene, is that discovering that actually, for all its conservatism, Mexico does have an amazing queer history and queer presence. And I think that's been a really cool thing to discover and to feel really, really at home here as a gay man, married. It's a nice feeling.
Very good. Ben, how about you?
So about a year and a half ago, I started doing some climate reporting for the New York Times International Edition, and my editor there last fall asked me for pitches to do with an intersection between finance and climate solutions. So I just basically blanketed anyone I know. Does anyone know anything? And lo and behold, all these ideas come in, because all of a sudden they're like, you might get it in the Times, and then they call you instantly. Yeah. So that's really fun after years of being a freelancer, when they're like, ooh, where? To be like, the Times.
What?
I remember one of the people, they were like, why don't we get you on the phone with the head of the Bank of England? And I said, no, absolutely not. I am not prepared to have I don't know enough about this topic. And we're just the planning stages. No. Anyway, I had like 14 ideas I submitted to her, and she picked one. It ended up being about fishing for squid in South America off the West Coast, and how climate change was affecting that. So it's a really interesting intersection of a lot of different topics, and very difficult because you've got all the science, the politics, fishermen's lives, and all this stuff, and economics. So I had left over all these ideas. So I've been working on basically the 3 right now. They all have to do with climate solutions and market solutions to climate factors. And then a more long form idea I'm working on which was based on a piece I did last fall for the Times, which is about crop engineering, genetic engineering crops to better withstand climate pressures. So that got me thinking about GMO, the hate of GMOs amongst many people, and were those people, those anti-GMO forces, going to really thwart progress as we're seeking to feed the world that's with a booming population in a time when the climate is getting more severe. So I'm looking at that as a long-term idea.
Wow, that's awesome.
Heavy. I only do everything. Exhausting sometimes, but that's where I might gravitate toward.
Very good. So real quickly, Ben, if people want to read more of your work, do you have a website, or where can they go find you?
benryan.net, benryan.net, and Ben Ryan Writer on Twitter.
All right, Oscar, how about you? If people want to read more of your great work, where can they find you?
Yeah, my website is Oscar dash Lopez .me, and you can find me on Twitter at Oscar Lopez Gibb, G-I-B.
All right, very good. Well, as we wrap up, I want to thank both of you, Ben Ryan and Oscar Lopez, for sharing your expertise and your insights, and really just all you are and do with our members and guests. So thank you. Thank you as well to the CDC's Division of HIV and AIDS Prevention for the partnership and support. And finally, I want to thank all of you who joined us today. It actually really means a lot. NLGJA, the Association of LGBTQ Journalists, will continue to try and host additional webinars highlighting the great work and contributions of our Excellence in Journalism Award winners, as Ben and Oscar are. So we'll hopefully have that posted online on our website, nlgja.org, soon. A quick reminder that this particular webinar will be it has been recorded and will be posted for posterity, also at nlgja.org/new ways. Other than that, I think that's it. Thank you all. Ben and Oscar, I hope you all have a great Friday. And hopefully we'll see everyone soon. So thank you.
Thanks, everyone.
Thanks so much. This is great.
Bye.
Bye.